nasal flaring, head bobbing, and cyanosis. In this module, you will learn to identify nasal flaring, head bobbing, and cyanosis. The first objective is to recognize nasal flaring, head bobbing, and cyanosis as signs of respiratory distress. The second objective is to differentiate levels of respiratory distress based on physical exam findings. Nasal flaring is the widening of both openings of the nose during inspiration. Some infants and young children who are in respiratory distress compensate by flaring their nostrils while breathing. Flaring of the nostrils helps decrease the resistance of air during inspiration by increasing the diameter of the upper airway. Persistent nasal flaring is a serious and concerning sign. Nasal flaring indicates that a child is in respiratory distress and needs oxygen and emergent medical care. Note: if you notice a child with nasal flaring but no other signs of respiratory distress, the cause of nasal flaring could be pain, discomfort, or fatigue. Let's look at some examples of children with nasal flaring. This child is in moderate respiratory distress with nasal flaring and supraclavicular retractions. We cannot see the ribs, but we would expect to see retractions. Notice that the child is awake, alert, and is looking around the room, which is a reassuring mental status. This child needs urgent medical care. Notice the patient has subcostal, intercostal, and suprasternal retractions along with nasal flaring. Head bobbing is when the head moves back and forth with each breath. Some infants who are in respiratory distress use their neck muscles to breathe, which causes head bobbing. Head bobbing is always synchronized with breathing. Head bobbing is a worrisome sign that an infant is working hard to breathe. Infants who are head bobbing need oxygen and emergency medical care. Let's look at some examples of children with head bobbing. This child is in severe respiratory distress because you can see subcostal, intercostal, and suprasternal retractions, nasal flaring, and head bobbing. Notice that the mental status of this child is lethargic. A child with severe respiratory distress and lethargic mental status is worrisome and is at risk of respiratory failure. This deserves the highest priority and attention. Cyanosis is blue discoloration of the skin. Central cyanosis can appear in lips, gums, and the tongue. Peripheral cyanosis can be seen in places like earlobes, fingernails, or toenails. In the acute period, central cyanosis is more concerning, as it suggests decreased levels of oxygen to central organs. Central cyanosis can mean dangerously low levels of oxygen in the body. It is a late sign of respiratory distress, and it is a medical emergency. The main ideas are that infants who are head bobbing and nasal flaring likely have moderate to severe respiratory distress and need oxygen and emergent medical care. Central cyanosis is a sign of severe respiratory distress.